Hey everyone, Dr. Underwood. Today, look what we have, this beautiful REPEX table. This table is designed to help patients with low back problems and or leg pain. Miss Demi's going to be our helper today as a patient. She's been having low back pain going down into her right leg. So what I'm going to do, you can remove your mask, Demi. Okay. And we're going to position her on her stomach. And once she's down there, I'm going to remove my mask as well. So a lot of people said, well, what is this table? Well, let's look down here. It's a repeating end range passive exercise table. So what Robin McKenzie and Hill's Laboratory did, they combined their efforts and they produced a table that helps patients with acute and chronic low back pain. So what we're going to do is we're going to first strap the patient in. Come down here just a little bit. There you go. I'm going to go right above her sacroiliac joints in the lower portion of her back. There we go. Okay, we got her locked in. So what we're doing is we're really just stabilizing the area around L5-S1, and then this is going to put her through a series of flexion and extension type movements passively, where the patient doesn't participate. It's done by the equipment. So over here we have a panel, and we can incrementally increase this 0.5 degrees at a time. So right now we have 4 degrees of extension and 4 degrees of flexion. So we're going to turn it on. We're going to let it go for a couple minutes. Then we know, because we treated her previously, she's an extension responder. So we're going to take away some of the flexion and increase the extension. Okay? So here we go. Demi, are you ready? Mm-hmm. Okay. And we're going to start it. And as you see, it's putting her in flexion, and then it's taking her into extension. So we're going to sort of warm her back up for a minute or two with this protocol. So right now she's at 4 degrees flexion and 4 degrees of extension. Now, the other beautiful thing about this equipment is we have a safety mechanism. So let's say we leave the room and the patient, something happens and she needs or he needs to stop the equipment. There's a little button here they push, and it just completely takes the table back to a neutral position. Okay, Demi, so what we're going to do next is we're going to lower the flexion, and we're going to increase extension by a couple degrees. So now we have her at 6 degrees extension, 1 degree of flexion. So what we do, after we do the machine assisted exercise, we give her some exercises to do at home between office visits that mimic the movement of the table. So how are we feeling, Demi? Feeling pretty good?
Yeah.
Yeah, she originally came in low back pain. It was going down her right leg. So the key to this is we want to centralize the pain out of her leg into her lower back, okay? And this is designed to do exactly that. So typically a treatment time here would be about 10 minutes. We're fortunate that we have 4 of these in the clinic. The only one that I'm aware of, there's one out in Wesley Chapel in a hospital out there. So we're pretty fortunate to have 4 of them in the clinic. So this is utilized on a daily basis in our practice because low back pain really is the #1 condition that we treat. So we're going to pretend like she's completed the 10-minute protocol. Then it would take her back to a neutral position. You would hear the beeping. So then one of the therapists would come in. They would take the patient, remove this from her lower back. She can go ahead and sit up. You can go ahead and sit here. So then afterwards, we'd run her through a series of home exercise that mimics the table's movement. And then we'd bring her back in a couple days, reassess her. And again, this is called the REPEX table by Robin McKenzie and Hill's Laboratory. They combine efforts to create this beautiful piece of equipment. We have 4 of them, guys. And remember, until I see you next time, wear your mask and please socially distance. Thank you.